I'm experimenting on you. I've only got pictures. So I wanted to say a couple of things after Vince's excellent presentation. I'm a psychiatrist, and most of my work is dealing with people in a clinical situation, either refugees who have often been tortured, or people in the Mount Sinai Trauma Program who may have been tortured, but they're more likely not to be refugees. And one of the unnerving things is what we as doctors and nurses and health professionals can do to people unwittingly. In fact, well, I'll come on to that later, but I have people who, with the best will in the world, come in and I say, how can I help? What's the problem? And they say, I have a serotonin insufficiency. Or my doctor diagnosed me with, I have depression. It's like unwittingly we give somebody something static. And I think as we're all here because I think we probably all share the idea that mental health is not a static thing. I'm sure, I don't know, everybody looks so young to me, but in our lives, there may be periods where you have a panic attack period or a time when nothing goes right, or it's not a static experience, and it's always has the hope that environmental components will change. Poverty is a very tough social determinant of mental health as well as physical health. So I think the two particular diagnoses that Vince chose, schizophrenia and autism, are tough because they don't tend to be so dynamic. An autistic kid their life can be optimized, but nothing probably will change that situation. I mean, there are some interesting new techniques coming out, but for most autistic children, that's what they will probably be. And sometimes that's the most useful thing you can tell a parent. At least in Ethiopia, people bring kids who are quite disabled in lots of ways, and there's nothing we can offer them. There are no programming, and yet what the parents want to know is, if I work really hard, will this child grow into a normal child? It's like, well, who else do you know? You know, that's sometimes very important for a family with who's got to sort of think about resources. So what I wanted to do was be a little bit, want to turn things on their head a tiny bit. Oh, disclosures. I'm a psychiatrist and I don't really treat refugees. I see them at CCVT. I have worked with very good counsellors, and I just usually write their report. So I'm seeing people very, very early on in, God willing, their life in Canada, although some of them will get rejected, which is very painful, obviously for them, but it's a very difficult period when they don't know if they're going to be in or out. So why involve the family? When to involve the family? How to involve the family?
Sorry, one more
adjustment. I mean, the lovely thing about working in Ethiopia and with refugees, probably with anyone, is I'm always wrong. I get used to it after a while. But I remember realizing how invisible my own culture is to me when I was in Ethiopia, which I love going to. It's the most wonderful place. And after several years, my dear colleague said to me, Dr. Clare, we know you love us. Why do you shout? Me shout? I never shout. I'm trying to be clear. And that is not... So my own values and ideas about what is a good thing to be are not the same as most other people's in the world. Right? I share a tiny culture of middle-aged women. I usually know where they bought their shoes. But the rest, if we take a cultural stranger stance, it leaves sometimes people more room to tell us what's really happening, rather than we get our own comfort from telling people what to do. What's wrong with them, what to do about it. This is a perfect family. Gorgeous, beautiful people. That too. That too. People beautifully posed, gorgeous looking families. Probably you all come from families just like that. No, probably not. There's no such thing as a perfect family. The thing about a family is it's a crucible. Do you know what a crucible is? Do you remember chemistry when you would make a chemical experiment, which always involves great heat, and you'd make it in this sort of indestructible little dish called a crucible. And I always think that's what a family is. It's in that indestructible little dish we go to great heat and transform ourselves into relatively normal or ordinary people. But it's not easy being in a family. And it's not ambivalent. We love our family. You know, can't live with them, can't live without them. And refugee families are no different to ours. There's always somebody you absolutely love and can turn to, and there's always somebody you hope isn't sitting next to you at Thanksgiving dinner. And because I know nothing about any culture that isn't middle-aged women, I will always be wrong about when to involve families, why to involve families, how to involve families. So I can only be perfect mother and child. And this is how all refugees look, or all immigrants look. Who's been to a swearing-in ceremony? Yeah. I cried all the way through mine. It was so moving. And everybody cleans up real well. You know, everybody looks shiny and bright and gorgeous and excited and happy. And it's not a bad day. It's a good day. But that's obviously what we see on the outside. Refugees have been coming to our country here forever, but they come from different places with different experiences. I'm always moved by this one. Some poor woman trying to manage a crying kid. You know, it's endless. Getting here is really difficult. Somebody who is in a refugee tent trying to have some kind of privacy, I guess. And here's a woman with her children. So, although people clean up beautifully, they come from all sorts of different experiences that one can only guess. And again, one's usually wrong. Because if somebody tells me, do you know what's wrong with this picture, by the way? Can you guess what's happening here?
Frustration, despair.
Yes, frustration, despair. How old is he? Ish. 10 or under? So what's missing? Yeah. I love this picture. Do you recognize this photograph? It's from the Depression. It's a photograph taken in the States. And I love this photograph because this is clearly a woman who's impoverished. And yet her two children don't have to worry. They can bury themselves in her body. And she's grown up and competent enough to take on what it means to be poor. And just in time for the movie. This kid needs that. Right? Children aren't equipped to manage the kind of pressures. Child soldier. I think that's in Palestine. And some kids don't make it. This is actually the worst. I sort of feel I must put it in, but it's a terrible picture. There's a little girl and a little boy, and the caption says, traumatized. 5 siblings were orphaned when US soldiers fired on their car yesterday after it failed to stop at a checkpoint in Tal Afar, Iraq at dusk. Their parents, who were in the front seats, were both killed, and one child suffered non-threatening wounds. So it's a tragic state. This is from the Toronto Star. It's not an unusual picture that we see every day. But the reason I put it up is this little girl is screaming, not surprisingly. And already people are trying to reach out to her. What I worry about, what we worry about, is that little boy who, it's not that he'll get missed, but his distress isn't visible. He's scared. He's scared. He's maybe dissociating. He may not really be taking in a whole lot, but somebody needs to be available for him. But not everything is a bad thing, right? Sometimes you get the best soccer games and the best parenting happening in refugee camps. Have you seen the Lost Boys of Sudan? It's really, I hate work. I'm like, you know, romantic comedy is the best I can do on a Friday night. But I did love that movie, largely because the boys had got so close to each other in this awful trek. And then when you see them disperse, they give each other, you know, a pair of trainers that are 99% worn out, but there's a little... I mean, they give each other their most precious possessions. And we forget that sometimes in the hardest times in life are the best times, because something very important happens around relationships. This is a woman who's just lost her child. I put it up because she's clearly distressed, trying to, you know, more isn't necessarily better. When people are distressed, sometimes they really do need a cup of tea and some privacy. And I always think of men and women culture as being different. I doubt if the men in her family are feeling any less distressed, but they show it differently, like the little child we just saw. So one has to be alert to distress. Oh, there's the movie. So that was I hope it didn't, it's troubling, isn't it? Mm-hmm. 1 minute. Do you think that guy needed treatment? Should he be on SSRIs and in therapy? I think so. I think you're right. So the families we see are wary, perhaps, just beginning, quite established, but in and of themselves have more resources than we can actually imagine. They may look weird, not physically weird. One may not understand how it all works. But most of the world is organized within families. Most identities are group identities. It's not Claire, it's Clare Pain, me and my family. I am me because of who I am related to. We have that extraordinary experience most of the world doesn't have, where I don't have to talk to my neighbors, I can be very distant with my colleagues. Most of the world has to get on, and is rather better doing it than us. So I wanted to end with this extraordinarily lovely photograph of a family showing perhaps some of the depth of the resources that people have. All right, that was a very fast video.